What we've got for you now is an amazing bunch of people who are going to share with us a toolkit and that we can use, and they're also going to ask for our help in making it even more better and brilliant and amazing. So they are going to ask for our help.
I'm Jane Cook. I'm the Health and Social Care Lead at Groundswell. I'm a health visitor and nurse by background, been in this field for a very, very long time, archived by the Museum of Homelessness, which says it all.
Hello everybody, I'm Lisa Gavin and I lead the Inclusion Health team in Surrey, and that is that we deal with all kinds of homelessness, including gypsies and travellers with insecure places to be, and I'm a health visitor by background, public health nurse, and that's very much public health is the heart of everything I do.
Hello everybody, my name's Anne Dowling and my posh title is Digital Transformation Specialist. I like to think of myself as a digital matchmaker, so it's about connecting all the dots and making it all sing together. And I've been delighted to work with Lisa and Janie, so we are sort of like a collaborative, if you like. So we're here today to talk to you about a toolkit which is all for you, so it's only about you for the next sort of 20 minutes or so. So first thing we'd like to go through is an introduction and an overview of what we're going to go through today. So the bit of an introduction of who we are, where we got to, and why we think this is so important for people dealing with homeless families. We're going to look at breaking the cycle in public health so we can really be optimistic, and I have been extremely encouraged by everything I've seen today. I think it's amazing, and I know that families experiencing homelessness is a terrible tragedy and a reflection on our society. But I do think we should dare to hope, and I think we should be very optimistic, because if you look at how many people here are so committed, I think it's a great opportunity for all of us. We're then going to take you through the Inclusion Health Toolkit and give you an overview. That will be a real whistle-stop tour. So if you're thinking of falling asleep, fall asleep now and then wake up for the toolkit. And then we're going to take you through a few assessment frameworks that we have prepared and been working with. And we know that some of you have assessment frameworks, so we'd like to have a look at those as well and share them. And then we're going to ask you to join us. And will you join us in building the future? So our digital toolkit is only going to be as good as all the contributions that we have. So we'd like to invite you to join us there. And you'll be handed out a form at the very end where you can fill in your details and see what you might like to be in it, what's not included, what is. And at the very end of today, at the back, we'll give you a summary. So if you don't want to write lots of notes and you're really tired of writing notes, you can just sit back, relax, and at the end we'll give you a two-pager overview of the digital toolkit. So I'm going to hand over to Janie.
So these figures won't surprise you at all, but they remain shocking. And I'm not sure they include hidden households or sofa surfing. So I'm sure the numbers are not as accurate as they should be, but still very shocking, and they rise very, very rapidly. And you can see the impact that this has on both children and adults, and also for the unborn child, who are often born premature with lots of health issues that accompany that. And the next slide is one that might be well known to some of you. This is Victoria Clumbier. I had the privilege and honour of meeting her mum when she was over here. And Victoria would have been 34 years of age this week, but she died very sadly on the 25th of February 2000. And it's very much the frameworks we work in, and it's thinking about your frameworks, how you see homelessness, so the safeguarding issues, the children's rights, which we're going to hear about. And following the death of Victoria, Lord Laming led an inquiry called the Laming Inquiry, and in his report, one of the recommendations was to have a robust national notification system, which I know the Shared Health Foundation are campaigning for. It's long overdue. And so one of my issues of how do you communicate with each other, because yes, the Notify system, which happened after the Laming Inquiry, is non-functioning. And also he made recommendations about agencies working together and using one set of notes and the sharing of information, which is a real gap. So I'd be quite interested to know how you do share information, because we know with single homelessness, we have homelessness forums, but for children, is there a mechanism where you work? So a show of hands, do you have a homelessness forum which focuses on children and families only? No, you can see that's, a real need. And it is part of integrated care, and the ICBs and Fit for the Future, I think it might be called Unfit for the Future if they don't get extra money. So, and it is a public health issue. This is our WAB, Isaac, who died a few years ago, and the naming inquiry was launched in 2003, so long time ago, so it needs to be there. And with the impact of homelessness it's a lifelong issue. And I was just going to show the next slide.
It's not working, so I'll get
okay. Something's happening, though, that's good. And it shows that often what we see in childhood, and we've heard a lot today about childhood, that we see it. I work in single homelessness now, and we see people who come with adverse childhood experiences. So there's a lot of premature deaths and comorbidities for older population who become single homeless, and it's generational. And it is a legal requirement of integrated care boards to tackle health inequalities. So now I'm going to hand over to Lisa. Thank you.
Thank you, Jane. So I'm just going to talk a little bit about what we've been working on. So it's a toolkit that puts together lots of resources, lots of information, lots of places that community practitioners can go to get information about all the things, the aspects of homelessness. This was primarily begun as a work for community nurses, and it is being hosted by the Queen's Nursing Institute, but actually it's of absolute relevance to anybody working with homeless families, so we hope it will be a useful tool. We'll describe a bit about the actual toolkit. We're going to get some feedback. Jane has already mentioned about the forms. We would be very grateful if you could fill them in. And anybody who's willing to pilot this would be really grateful. The other aspect is that we've got an assessment tool, and so that's going to be part of that toolkit, and that's something that we'll talk about a little bit more after that. So, next slide. Thank you. So I know everybody's getting tired, and I thought I'm going to just kind of riff a little bit here, because one of the things I want to talk to, we talked about storytelling and the power of storytelling, and what I wanted to do is just give one example. The actual matrix that we're in the process of developing is looking at how we look at all of the complexity and the time involved, and so we can actually demonstrate how much extra work is really required to support homeless families. But this is one child, just one child of many, and this child stays with me, but this is an example of the sorts of complexity that we see in homeless families. In my case, we cover all of Surrey, and of course people think leafy Surrey, homelessness, how can that be a thing? But in fact, we know that every part of the country is affected. The cost of living crisis, post-pandemic, all of the, we had a lot of hotels in the southeast of England, had the highest concentration of asylum hotels. So we've done a lot of work to stand up clinics, work with our primary care colleagues, but also we've developed an outreach service to all of the hotels. Offshoots of that were things like developing community kitchens, lots of other social initiatives, and but this is just one child. This child was in a hotel very close to Gatwick, and his mother had escaped from her country of origin, a North African country, and when from her family, and the child was actually just born in the UK, and as you can see from the picture, he's albino, and there was huge pressure from the family in the country of origin to bring this child back, because they believed that that the mother was a witch for this to have happened, because she'd come from a remote village, and they wanted to sacrifice the child. So this was really, because the hotel was very close to Gatwick, and because there was so much pressure on the mum to return, even though obviously she didn't want to. This is an example of things that would come across normal universal practices of health visitors or probably even GP things, but this is one of the many, many, many very complicated things that is another aspect that's very rarely talked about with homelessness. So this involved us communicating very closely with the Home Office, getting the mother and child moved to the other end of the country, actually near Sheffield, connecting with the paediatrician so the baby could have all the screening and the follow-up and the genetic work that this child needed to protect his eyes, to follow him up and make sure that they were safe. So again, we've talked a lot about the siloing of different services. We as a team work very closely with our housing colleagues, and until last week there were 11 districts and boroughs in Surrey, all with different housing managers, all with different systems, and now there's going to be 2. I think Surrey is the first of the reorganisation, so an East Surrey and a West Surrey, but there are all the other complications that are also going on that inform the wider system. So the reorganisation of the ICBs, Surrey and Sussex, huge areas, going to be one ICB, so that's going to affect commissioning, it's going to affect how we respond, we're worried about a bit of a brain drain if people are leaving their jobs and moving and all of the chaos of reorganisation. So it's even more important than ever that we keep in mind those children and that we keep those existing relationships we've developed and actually work really, really hard to develop them further. So I'm going to talk very briefly now about the actual framework. We won't go into the whole thing. Anne's going to show you the toolkit itself with the resources, but the assessment framework is looking at 6 domains. It's still very much a work in progress, and I'm just going to give you an example of one of the domains so you can get an idea of some of the questions that we're looking for. We are hoping to develop this and have this as in the future, to get this developed so that it can be across systems, embedded in EMIS, Rio, whatever systems people are using. Janie, can I have that one back for 1 second? Thank you. The other bit was the complexity matrix, which is again another piece, and that's a way using a model that has been used in other clinical settings. For example, the children's community nurses, who are like district nurses for children having care in the community. So they have a way of measuring their caseload based on the complexities. So this is something I've been developing that's very much homeless focused, and grading it from red, which is very, very urgent and very complex, to the green, which is they're still in what we would call enhanced families with additional needs, but they're in a place where hopefully they've got a lot of support around them, but we still don't want to lose sight of them until they're in a secure situation. So the next, just to give you an example, so this is just the environmental domain, and we're looking at things like the type of accommodation, all the things that have been talked about, access to a kitchen, whether that's even a usable kitchen. I won't bore you by going through all of those, but things like vermin, infestations, and even, this year we've come across families, and again, I would say this is leafy Surrey, but we have people with rats in their properties, cockroaches, and I don't know if anybody else has seen this, but because of the very hot summer, clouds of ladybirds, which for some people, some of us, if we see one ladybird, think that's good luck, but other people were absolutely terrified and saw this as something really macabre and very worrying. But lots of things that affect the environment that the child is living in, and how those children are growing and developing, and all the things, whether they've got space to move and crawl. We're seeing all sorts of things that have been spoken about, like developmental delay, because children cannot physically learn to crawl on a floor, no space, not clean, all of those sorts of things. Speech and language delays. We've seen a lot of that in the hotels, because the children are not eating the sort of food in some of the asylum hotels. It's not necessarily suitable for children, and they're depending on sort of yogurt, those yogurt things that they can suck on, things like that are actually stopping their chewing, delaying their speech, affecting their health in all sorts of ways. So that's, I think, very quickly, I'm going to show you a bit about the matrix. We're just literally, on the left you can see we're identifying the complexity, This is just a couple of samples. So, for example, if you could, if you can multiply the level of complexity, and we've measured, for example, how many health professionals or other agencies are involved. If there's 6 and above, and that's not difficult with some of these very complex families. If there's if a mum, for example, presents in late pregnancy, hasn't had antenatal care or has missed antenatal care, obviously that matrix, looking at the complexity and then measuring that by the response that we've got, will give us an idea of evidencing this level of complexity. The reason this is important is because this is for clinicians, but it's also for the managers, for the commissioners, and for our reporting, because what we do know, those of us who work with homeless families know how complex this is, but many of even the managers, NHS managers and others, don't necessarily understand how much time is involved to provide a safe service unless they've got, and there's no evidence, there's no way of collecting this at this stage. So we're really hoping this tool is going to provide evidence about exactly what is involved to deliver a service to people with multiple needs and often comorbidities as well. And the benefits speak for themselves, so I'll leave it there. Thank you.
Can I just get you to switch to the toolkit? Thank you. So as we talked about at the very beginning, we've done a toolkit, which is essentially resources for professionals, and we're just going to scoot through them. But essentially, it's starting off looking at the assessment tools that people might have. It's actually looking at how we can make those connections, looking at partnerships. If you're new as a health visitor, there may be some resources here, if you're training and so on. So I'm just going to scoot through, but essentially we have done a lot of work, and I'll just get you to scoot through because this isn't, batteries have run out. So if I look through here, the first couple of sections are really looking at how we need to understand the resources that you've got. So it's about breaking the cycle and building futures. And as you can see along the bottom, there's foundational guidance for you. There's some practical tools. There's the family needs assessment tool, which we've just talked about. So there's the family needs assessment, which is very much focused on families and children as opposed to single homeless people. Then you can roll that up into looking at some form of complexity, so you know actually how much resources you need to have. Then it's about looking at building skills and confidence, and we have a number of papers and opinion leaders' reports in there as well. And then finally, some case studies and best practice. So if I can just get you to skip through to the case studies and best practice. Okay, so what we've done, and if you've got a case study or you'd like to share your best practice of how you work with families who are homeless, please do send them through to us, and we've got some notes for you. So we've just done a few at the moment. So some of you may know the Magpie Project, Surrey Child and Health, Family Health. We're very, very pleased to be working with the Queen's Institute of Community Nursing, because they're going to actually host this. So once it's all finished and we've piloted and everybody like you are happy with it, that we've got all the right questions in there and we've got the right resources, we've got the best practice, we'll put it up onto the QNCI website. And then we've looked at some other projects that you've actually got there. So we've nearly run out of time, but I just wanted to go back to the original presentation, please. Just where we are at the moment. So this is a longer term project. So we're doing our scoping and testing at the moment. We're looking to build our alliances, and you'll notice there's collaboration all the way through. We want to work with people so we can build this network and make sure that we represent people. And then finally, my big goal is that we actually use AI for the best intentions, so we can connect the dots, we can be that digital navigator, we can have the notification system, we can have, for instance, really great intelligence that says, this family, here's a snapshot, this is where they are. You don't have to look in lots of different siloed systems and so on. So if I just pass through to the next part.
So I'm just going to speak to this part. So we want to pilot our assessment tool, which is very comprehensive, focusing on children and adults, and it can be used as a notification tool, so sharing it across country, and also using it for commissioning, collecting the evidence. So there's lots of detail on how we can use it. and especially as we're going into NHS 10-year plan, neighbourhood centres, how we can influence children's centres and how they need to incorporate families experiencing homelessness. So we'd ask you, I know there's a form going around, if you're interested in piloting the assessment tool, please fill it in and either give it to us or to Sam and Laura, and then we will set up webinars to go through it with you quite comprehensively. But it is a long-term project, and we want to set up a think tank working with the APPG to actually really shift this notification system. You know, that it was recommended by Lord Laming in 2003 is just unacceptable. And we're seeing the siloing, and it's really about all the agencies working together. So seeing it as a public health crisis, seeing the social determinants of health and bringing together with the child at the centre and the family there at the centre. So working together and having forums that actually are focusing on local need. So thank you very much, and we look forward to working with you. And now we're going to talk about the rights of the child, which fits in very nicely.